Hello, I'm Ann Taylor, and I am a resident of Burlington, Vermont, and I'm here to speak about being a consumer of medical care. And I also am a provider of medical care, but this particular discussion is about my being a consumer. And I wish to say that I'm a high-level consumer of medical care because I live with stage 4 breast cancer. And for those who don't know what stage 4 is, it's advanced metastatic breast cancer. It means the original cancer has moved to another location. And it's also pretty much a terminal diagnosis. So when I was diagnosed with this in 2002, I was pretty much statistically, I was told, I would live till about 2005. Well, as we know, it happens to be August 30th, 2011. So I guess I've made it beyond that time. And I certainly can offer that, everybody says, well, how'd you do it? What is the reason? The reason is that I use complementary and alternative practices to augment and complement the use of traditional medical care. I have definitely been well taken care of. It also has to do with the fact that I am highly educated and do have the financial means to add to the health insurance that I do have. When someone has level 4, stage 4 breast cancer, they automatically qualify for full disability, which qualifies you for Medicare A. So I'm like a senior who is 65 years young and has a Medicare policy. So I also supplement that with AARP's United Healthcare. So they cover what Medicare does not. And so essentially, my experience has been that I have not been refused any care whatsoever. And it's truly remarkable. Medicare really works. And by the way, it's a system that's run by the government. And so all of this argument that we are in presently in the United States of America is ridiculous. First of all, it's amazing how well I'm covered. And the quality of care is the best that we have in the United States. I've not been refused any medicines. Oh, by the way, thanks to the Bush era, when he created the donut hole, we do now purchase a separate pharmaceutical policy, and that's called Medicare D. And the donut hole is actually a point in time, actually based on how much you've spent on your purchases of pharmaceuticals. There's no coverage. So Bush left a lot of seniors in a very difficult situation with that. So in other words, a couple $1,000s Medicare pays for, and that's because you purchased a policy, and I purchased the best one, and then you reach this point of $2,000, $3,000, and things are covered well, and then the donut hole, when you reach it, is you have zero coverage, so you have to pay cash 100% for the particular medicine. And then when you reach about $4,000 or $5,000, then Medicare kicks in. So I have the means to take, to pay for my medicine, but I always say to the pharmacists and other people, I don't understand how anybody on a fixed income can handle that. And I really resent the fact that the pharmaceutical companies have done extraordinarily well with this Bush-era program. And it's also tremendously embarrassing as an American to know that Bernie Sanders, for instance, our senator, took a busload of seniors across the Canadian border and made an excellent point. Those seniors purchased the same medicines that are made and sold in the United States at a much lower price. And that was a media event, and it drove home a great point. Our consumers in this country are really being taken advantage of, big time. And the high-powered interests and lobbyists of the medical industrial complex it's terrible. It's absolutely terrible. And the other piece is I very much support a government-run program for everyone. We absolutely need universal health care in this country, and Vermont is on the path right now to create a statewide program, which I highly support. And I just think it will greatly reduce the hassle and the pain and the suffering that people are going through with regular insurance companies. And there's so much fear. People are waiting to go in for diagnoses when they should go in earlier and have preventative programs, so an early diagnosis. So we're missing out on a lot of things in this country by not having one highly workable program versus multiple profit-oriented systems, health insurance companies. So, you know, and we should really be embarrassed. I am embarrassed. We're the only industrialized country in the world that doesn't have a system of health care for every citizen. It's embarrassing. So I firmly support that we, in this country, provide health care for all, at least the most basic of services, and based perhaps on a scale of income. And you know, the solutions are there. We just have to shift out of healthcare being delivered by companies that are based on profitability, because it's a disincentive to have a company that makes more money when you get less care. It doesn't make any sense. So therefore, let's get a universal health system. Thank you.